To look at global health, and this is our first presentation. Basically, we'll know what global health is, why do we interest ourselves in global health, and what are the historical perspectives on global health, and then possibly also understand the career opportunities in global health, where can you work as a global health professional, and then you will also be able to explain the different perspectives. So therefore, those are our objectives. So global health refers to the study, practice, and the pursuit of improving health and achieving equity in health for all people worldwide. Okay, so basically, it is it's a discipline that is multidisciplinary in nature, and that tries, where professionals attempt to solve global health problems around the world. Okay, so it looks at the globe as the unit of analysis, or looks as the globe as the area of focus. Okay, so of course, we have many global problems. We have problems related to disease burden, where we have infectious diseases, non-communicable diseases, mental health issues. We also have issues to do with conflicts. We have issues to do with global warming and other climate change issues that negatively impact on health of people around the world. Okay, so we move forward. So what is the importance of studying global health? Of course, our interest in global health is to make sure that everyone, regardless of where they are staying, they are having optimum health. That you don't want to see people of low economic status having poor health outcomes compared to people of higher economic status. So you don't want to see disparities amongst countries or within countries. That way, that health is regarded as a fundamental right, where their socioeconomic status, or where they come from, their tribe, or any other characteristic. So that means that if that is our interest, then it means that we need to address problems that contribute to poor health. And these problems actually cross borders. Okay, we have health risk factors that transcend borders. So we need to address these problems together, okay, because the globe is interconnected. But again, if you address problems that contribute to poor health, it means contributing to global stability, security, and economic development. So we move forward. So what is the history of global health? Global health has a history that can be traced to the 1920s, 1930s, where the one used was tropical public health. And this happened during the time of colonialism, okay, or colonial explorers, where their interest was mainly to get expertise to treat treat and also control tropical diseases which were common in the countries were colonized. Okay, so the healthcare system then was focused on protecting the colonial masters or colonial administrators. Okay, so that means that the training of doctors to work in the tropics or in tropical medicine was basically focused on getting the expertise to treat these diseases. Okay, so we move to another key milestone that contributed to which was the Second World War, which happened between 1939 to 1945. The World War had a lot of impact on global health because the soldiers who participated in this war were exposed to various health conditions during this time. So there was need to have interest, there was interest in how to treat these conditions, and particularly many public health interventions and their origins during this time. Okay, and then immediately after the war, the World Health Organization was formed in 1948. Okay, so World Health Organization had a lot of impact on global health. By one, it provided leadership on issues in global health or health matters that affected the countries. So WHO was involved and is still involved in policy development and establishment of health guidelines. Okay, and then it therefore also it shapes or it even shaped by then global health research agenda. So WHO is involved in research and also developing policies and providing guidance or guidelines on how to handle different health matters of global magnitude. So it sets the standards that countries can adopt into their context. Then, of course, over the years, the World Health Organization has contributed to improving health globally. Of course, there are many interventions where WHO has played a lead role. Okay? For example, the eradication of smallpox is one of the key milestones in global health. Through research, through implementation, collaborations and partnerships, and things like that. And also problems that contribute to mortality in children. WHO has played a very important role through, of course, like I said, research, policy, and then guidelines. Okay, so we have had improvement in child health because of WHO. So issues to do with reducing the prevalence of preventable communicable diseases, vaccinations, issues to do with controlling malaria. These have been very key milestones that can be attributed to the influence of WHO. So in the 1970s, there was emergence of alternative ways of handling health matters. So particularly in the 1978, primary health care or comprehensive primary health care was introduced as a model of addressing health problems. And this was endorsed in Kazakhstan in the Alma Ata Conference of 1978. Okay, so that conference had a declaration which aimed at ensuring that all people by the year 2000 were actually healthy. Okay, so basically it was about ensuring that everyone is healthy. No one is actually left behind. So that was basically about primary health care. So it was what countries were adopting at that time. And the focus was on ensuring that essential medical services are available, nutrition services, family planning, treatment of common diseases, health promotion, and things like that are available at the lower health facilities. And then we move to the fact that, of course, this model was adopted by several countries, but of course, there were challenges. These countries faced a lot of challenges, and some of the challenges included the fact that doctors never wanted to bring these reforms to their health systems. So one of the principles of primary healthcare is involvement of the local communities. Okay, so health workers thought that the local communities actually lack the capabilities to actually understand their own health needs and actually contribute to them. And then, of course, there was no clarity on how comprehensive primary health care was to be implemented across different countries. And there were no leaders actually to champion this or even to scale it. So it became actually difficult. So that this actually means that at that time, comprehensive primary health care faced systems. Okay, so there are countries that did not fully adopt primary health care as a strategy. So another model came in that is the selective primary health care, which is basically the opposite of comprehensive. Comprehensive basically looks at the common conditions and how to address them involving the community, technology, things like that. With comprehensive, with selective primary healthcare, the interest was on tackling particular problems that contribute the greatest burden in terms of mortality. Okay, so organizations that championed this included the Rockefeller Foundation. For them, they recognize that the top contributor of mortality are issues to do with breastfeeding, breastfeeding, venereal diseases, and how to actually tackle them. So the concept of GOBI, FFF, was introduced. GOBI FF is just an acronym that stands for growth monitoring. Okay, stands for growth monitoring, oral rehydration therapy, breastfeeding, immunization, family planning, and the 3 F's for blood fortification, female education, and food fortification. So we are going to look at this. Let's see. Okay. So basically, with the selective approach, I said the focus was on factors that contribute to greater mortality among children. Okay, so the G, which is for growth monitoring, is about tracking the growth of a child in terms of weight and height. Okay, so the child immunization card has that that curve, that graph for plotting the weight. This is very important to identify issues to do with malnutrition, growth delays, and therefore health problems can be identified earlier. And then the second one, which is basically the oral rehydration therapy. Of course, diarrheal diseases are great contributors to child mortality. So oral rehydration therapy is very important in averting this. And the oral rehydration therapies are affordable and can easily be made. Consists of sugar, salt, and basically water. And then breastfeeding, exclusive breastfeeding contributes to proper nutrition and improves the immunity of children. And therefore, if a child is exclusively breastfed, reduction in mortality occurs, okay? Reduced mortality. And then immunization against vaccine polio, measles, tetanus, diphtheria, hepatitis influenza, and others. Hepatitis B. Okay, so immunizations are very important in reducing child mortality. And then family planning, where there should be access to information and also access to the services themselves, such that the family can make informed choices on child spacing, size, leading to improved maternal and child health outcomes. And then, of course, we also realize that nutrition is one, or malnutrition is a contributor to child mortality. And therefore, especially deficiency of micronutrients is a great contributor to mortality. And therefore, fortification plays an important role in reducing the deficiencies of these micronutrients. And therefore, flour fortification and the food fortification are very important in patients. And then female education. The more a woman is actually educated, the less are the chances of death. So selective primary health care focused on these problems in order to contribute to the well-being of children. Okay. So in the 1980s to 2010, there was a decrease in the power of the World Health Organization. This is because of increasing number of new donors and NGOs. And it's like there was a power shift to international NGOs and the emergence of new donors. And then different national ministries of health had also gained competence in order to deal with their own health problems. Okay, so that means that the dominance by WHO reduced. Okay, and the WHO, of course, relies on donations and funding from multiple sources, multilateral and bilateral sources. Okay, and at that time, the influence of the US in terms of funding the WHO actually increased during that time. But of course, as we have seen in the 2000, 2020, 2021, the US reduced its funding to WHO. Okay, so, and then in 2010 and then 2016, of course, the donor support, there was change in donor support. Donations started to go down because, of course, the impact or the value for money was not being seen in terms of long-term impact. And therefore, and also the other problem is that different governments in Europe faced budgetary constraints. Okay, so that means that we have seen that there was increase in number of donors, and then now we are seeing that the nations are actually coming down. Okay, then the focus during this time was towards what we call the sustainable development goals, and then the millennium development goals are actually ending around this time. So the concept of globalization and health, which basically now which we are referring to as global health, gained a lot of prominence, and where now we look at serious global health problems in terms of in the perspective of planetary health, and then also issues to do with climate change. Okay. So when we look at the perspectives, we are basically explaining the kind of thinking that has dominated, so that has been dominating the public health area, global health arena over the years. Okay, so we're going to look at how that thinking has been shifting over the years. So the explanation will actually resemble what we have just seen in the history of global health. So first of all, the topical public health element, like we saw, the tropical medicine in the history, where the focus was on dealing with the problems or health conditions that affected the less developed countries. So the focus was on training clinicians who can deal with these problems. So the focus was moved either clinical practice or control program implementation. Okay, so this was the initial thinking about global health. And then we move now to international health, the perspective of thinking in terms of national health, where we look at countries as the unit of analysis. So this is the perspective that focuses on comparisons, comparing the health outcomes between countries, of disparities between countries, and looking at which countries need a lot of priority. Okay, so then we move to the globalization and health stroke political economy. Health, this is now looking at the entire world population as the unit of analysis. This is the current or the contemporary perspective on global health, which is the recognition that you see the problems in one country will actually happen here. So this is no boundaries. It's the concept there. And then the last perspective that we shall look at is the perspective to do planetary health, which is that it is very important to keep our environment or the planet Earth sustainable. Okay, so human activities that contribute to degradation should actually be stopped, because this actually contributes to different health problems, and this is actually unsustainable. So it is the planetary health perspective in global health is about integrating issues to do with human health and then the earth, okay, and how they are influencing human health. Okay, so that marks the end of this presentation. Thank you.